We now have multiple anti-BCMA therapies, the CAR T cells, ID cell, and CILTA cell that are now approved, the bispecific which are coming soon. Teclistamab just got an approval very recently by the EMA, and elranatamab is also accessible in an early access program. So, and the last one is belantamab mafodotin, the antibody drug conjugate. So we have different options of anti-BCMA therapies. What we know is the loss of BCMA can happen, but is not something very frequent. So this actually raises the question of sequencing those therapies. And what we know, we start to have some data about this sequence. So we had in the MajesTEC-1 trial the teclistamab in late-stage patients. We had one cohort, cohort C, that was reported in patients who were previously exposed to anti-BCMA therapies, basically ADC or CAR T cells. And we see that the response rate is a little bit lower as compared to patients who were not exposed to anti-BCMA, but we still are able to rescue some patients and obtain a good efficacy in some of those patients. So it means that it's feasible and we can sequence those treatments. Now we have also some experience in patients who are exposed to CAR T cells treated with belantamab mafodotin after, and we see as well a good response rate in those patients. We have less experience in patients who were previously exposed to bispecific antibodies and that you will expose to a CAR T cell, for example. But this is something that will surely come in the future as we have more and more access to this new drug. So it's still a field that we need to work on, and we have still many questions truly about the mechanism of resistance to those drugs that will help to drive the sequence of those treatments.